Abduction of the arm occurs in the glenohumeral joint and scapulothoracic articulation in a 2-to-1 ratio. For every 3 degrees of abduction, 2 degrees occurs in the glenohumeral joint and 1 degree occurs at the scapulothoracic articulation. The scapula should not move until the arm is abducted to approximately 20 degrees. At that point, the humerus and scapula move together in a 2-to-1 ratio to complete abduction. If the glenohumeral joint does not move in its normal ratio, the client may have frozen shoulder syndrome. The Apley scratch test is performed by asking the client to place their arm overhead and reach behind to touch the opposite shoulder. This motion checks glenohumeral abduction, external rotation, and scapular upward rotation and elevation. The client then puts their opposite hand behind their lower back and reaches upward as far as possible. This motion checks glenohumeral adduction, internal rotation, and scapular retraction with downward rotation. These movements are then repeated with the opposite arms. The empty beer can test is used to assess rotor cuff injury or impingement syndrome. Position the client with arms 90 degrees of forward flexion, 30 degrees of abduction, and full internal rotation. Firmly press downwards on the arms and ask the patient to resist. Pain or weakness indicates a supraspinatus tear and/or the possibility of impingement syndrome. The drop arm test is used to assess for possible rotator cuff tear. Begin with the client's arm in abduction. Depending on the severity of the injury, the client may require their arm to be passively abducted. Observe as they slowly lower their arm to the waist. The patient may be able to lower the arm slowly to 90 degrees, because this is a function mostly of the deltoid muscle, but will be unable to continue with the maneuver as far as the waist. Often, the arm will drop to the side if the patient has a rotator cuff tear or supraspinatus dysfunction. Speed's test is used to assess biceps tendinitis. The client fully extends their elbow, then supinates their arm. The therapist stabilizes the shoulder. The client then attempts to flex the elbow while the therapist holds the client's forearm and applies resistance. Pain at the biceps tendon area during resistance is a positive sign for biceps tendinitis.